Hi, my name is Vina Wilson. I am the owner and operator of Honeybee Behavioral Health, as well as the host of the Honeybee Podcast, coming at you live and direct to offer information that I believe will be helpful to parents with children who self-injure. The first thing that I want to acknowledge is that for a parent, there is an understandable amount of fear, anxiety, and worry in finding out that your child has engaged in self-injurious behavior. My intention for this video is to offer helpful ideas that will aid you in navigating your ability to help your child get the support that they would need in order to take self-injury off the table as an option. Inasmuch as possible, I invite you and encourage you as the parent to take a step back and regulate your emotions upon finding out that your child has injured themselves intentionally. The reason that I'm making this recommendation is that because, understandably so, again, finding out that your child has cut themselves, burned themselves, or some other self-destructive behavior is frightening. So, of course, there is an inclination to ask a significant amount of questions. And in the moment of anxiety, fear, worry, and the like, you as the parent, in asking well-intended questions, may come off to the child as invalidating, as punishing, and they may have the impression that they are in trouble. I know that questions asked to your child is coming from a place of wanting to discover what has been going on and what led them to begin engaging in the behavior. For your child, on the receiving end, it may feel like a punishment. So please, inasmuch as possible, calm your emotions, and that will aid in your ability in having a conversation that is meaningful, helpful, and supportive to your child. I invite you as the parent to then become curious about whether or not your child's self-injurious behavior was their attempt of ending their life. For many children, engaging in self-injurious behavior is not done with the intent of ending their life. More likely, self-injury is used to manage and reduce overwhelming emotions and unrelenting stress. In finding out whether or not the self-injurious behavior was indeed a suicide attempt, that will then create the conversation with your child about the function or purpose of the behavior for them. Just because it is my clinical opinion and experience that a child engaging in self-harm is doing so with the intention of reducing emotional pain, your child may tell you something different. So please be curious about that. In this conversation, in the same way, it is important to not come across as punishing. It is also important to not shame your child for the behavior. I'm willing to be wrong on this. However, I don't believe I am. I believe your child is doing the best they can. And so are you. So in the same way, I do not want you to shame your child. Please do not shame yourself. Your kiddo's use of self-injury as a means to tolerate stress and unpleasant emotion is not indicative of you being a failure as a parent. Not at all. Finally, I encourage you to get professional help for your child in their ability and access in working with a clinician, a therapist, who is able to train your child on ways to tolerate stress effectively, as well as manage overwhelming emotions effectively, that will give your kiddo an opportunity to take self-harm off the table as an option. In addition, in the same way that your child will need support in navigating this issue, you as the parent will need support to discuss your experience of finding out and how to best support your child who is engaging in self-injurious behavior. I assure you that as your child develops and grows in maturity, the turbulent emotions that they are having will begin to integrate with the brain, and there will be emotional stability. This is even more likely when you assist your child in getting connected with a professional therapist, a licensed clinician who can help them on their journey. If you have any questions or concerns, please give me a call. Again, my name is Vina Wilson, and I am a licensed clinical social worker in Las Vegas. I can be reached at 702-980-5036. Until next time, peace.